Well, good morning. It's Matty here on 96.5 CAYROCK. Very special guest in the studio this morning, Dr. Nabil Khan from Doctors Hospital. Good morning, sir.
Morning. How are you?
I'm excellent. It's election day, so it's an exciting day.
Yeah.
And now we have you in the studio as well. So it's all going on in the KROK studios. So how long you been with Doctors Hospital?
So just over a year now, been
Just
with
a
them.
year.
Yeah. Been exciting times.
Going well for you.
Yes, definitely. Got to meet quite a lot of new people, new
Nice.
faces. Good working environment. Excellent colleagues to work with.
Wow. Can we swap? No, I think that could be interesting. So you enjoyed your time there.
I am.
Superb. And what's your specialty?
So I'm an orthopedic surgeon by training,
Okay.
and then have a subspecialty interest, especially in sports surgery and sports injuries.
Right, okay.
Yeah. So, and I do minimally invasive procedures, so shoulder arthroscopies, knee arthroscopies,
Okay.
and then shoulder and knee replacements. And then I have a little niche, and I've done this for a few years now, with basically minimally invasive therapies like stem cell therapy, PRP therapy.
See, that's a fascinating world, stem cell.
It always
is.
does lighten up a conversation, to be honest. And it's something that I think patients should be well versed about, especially here on the Cayman Island, because it's something that's upcoming and new. We've only been doing it for about 30 years now.
Okay.
So it's pretty naive and young.
Yeah.
However, there are some drawbacks and setbacks that I think patients should be fully aware of.
Okay.
There's a lot of controversial studies that have come out. Basically, when you look at, especially when I'll kind of narrow down to stem cell therapy, there's a lot of non-evidenced procedures that are being performed on island, and I think it's patients should be fully aware of that, and all the companies that provide such information. There's a big study that kind of I kind of allude to a lot, and this talks about how much misinformation and misrepresentation that companies provide to patients. 98% of the information that's present on their website is actually misinformation when it comes to stem cell therapy.
Seriously?
So it's an important thing to just make patients aware that you should really do a lot of research and speak to providers who've actually done some of these therapies or actually have an interest in it before kind of jumping and delving into it.
Yeah, because for me, it's all a bit science fiction for me. I don't really understand what it is. I've got some ideas,
Right.
About people who've worked in the field, but information's everything.
Correct. Yeah.
And there's almost too much information available to but a lot of people will just go and Google something and believe the first thing that they read.
Exactly.
So I think speaking to somebody who's actually been involved in the procedure,
Yeah.
has to be the way forward. So let's talk about surgery not always being the first step. What before surgery? What kind of things would you get involved in with somebody with some kind of injury?
So it's a bit difficult to kind of pinpoint and put a blanket statement out to say that surgery is always never the first option.
Okay.
It really comes down to what type of injury you have.
Yeah.
So yes, there are a lot of injuries that can be treated non-surgically, definitely, and a lot of surgeons are always advocates for non-surgical options. I mean, the first thing we learn coming out of any residency or specialty training program is that the knife is not always the first option, and that's
Right.
how you know. I remember one of my professors used to always say that's a mark of a good surgeon, the one who doesn't always pick an invasive option as the first option.
Excellent.
So it really comes down to what type of injury that you have. And just speaking about non-surgical options, yes, there are a lot of options that are available to patients. And when I speak to my patients, this is now personally, I always give them all the options, whether I know for 100% sure that, surgery is what is recommended for you. but I still go through the non-invasive or the minimally invasive options, and then put surgery as a last option.
Cool.
And then I give you my opinion, basically. And this is what I think, well, this is what a lot of surgeons do with their patients, is that they give them all the options. And that's part of what we call consent, verbal consent. There's different parts when you're obtaining consent for any procedure. Definitely. And one of the prerequisites is that you have to give the patient all the available options, and then give them an option that's suited to them according to current evidence guidelines, and then let the patient make an informed decision.
Informed decision is what it's all about.
Correct.
Yeah.
So that's what I usually do with my patients, and I think a lot of surgeons out there definitely do look into all available options before coercing, in quotes, putting a patient into that situation where they are forced to make an option. Superb.
Dr. Khan, thank you for coming to see us today. But before you go, so you've worked with sports injuries. You've specialised in that a little bit. What are your favourite sports?
So I'll put it down to football. Definitely.
Now this is a leading question, okay? Because I want to know who your favourite team is. Because this decides whether or not we're going to be friends.
It has to be. There might be a bit of a fighting or tug of war by me putting my name out there and saying who I support. But Arsenal would be my favourite team.
Arsenal's okay. Arsenal's okay. I'm a Liverpool supporter. Very happy at the moment.
I think that
Liverpool and Arsenal fans, we've always gotten along.
I think so too.
Yeah, I was just thinking, please don't say Manchester United. Please don't say Manchester United. Listen, it's been an absolute pleasure to have you in the studio today. And it's Dr. Nabil Khan from Doctors Hospital, and please do get in touch with Doctors Hospital. Ask for Dr. Khan by name if you're any kind of sports injury, what else would they come to you for?
So any shoulder problems. So we've got a lot of patients on the island who are struggling with cuff problems, and these are usually non-traumatic.
Right.
It's so. Definitely any shoulder or knee issues. It doesn't matter what it is, traumatic, non-traumatic. We can definitely help patients with that.
So there you go, guys. Dr. Nabil Khan, Arsenal fan, therefore. He must be a good guy. Thanks again for coming in.
Thank you.